Let's start this afternoon from Faana, an island community in the South municipality of the Greater Accra region, trapped between the sea and a lagoon. It's about an hour's canoe journey from the nearest community, Cliffe, which is itself a shoreline settlement. Many women at Faana are currently pregnant and face an uncertain future. We'll hear from a development NGO, Send Ghana, which is pushing to get the major political parties in the upcoming presidential and parliamentary election to include the construction of at least clinics in deprived communities such as Faana. Fires first, though, Henry Kwesi Bedu's report from that community.
35-year-old Kwame recounting how her wife in 2018 delivered their first child in a canoe en route a chief's compound miles away from the island community.
I went fishing when my wife was in labor. She delivered on her way to the hospital in a canoe. The hospital is very far from where we live. I was afraid something might happen to my wife because the health center was a distance away.
His wife is lucky to have survived, but the fisherman is worried because his wife is now 7 months pregnant, expecting a second child soon.
I am now afraid that something may happen to my wife the next time she labors.
The only way to access the community is by canoe. With no electricity, water, and other basic amenities, pregnant women and other members of the community in dire need of health care will have to risk their lives by sitting in paddling canoes without life jackets for close to an hour to reach the nearest health facility.
There is no clinic here. There is no anything that can help an individual or people here so that they will be able to give birth. That is why normally when they're in a labor, people normally convey them in a boat to Chokome or the other side, that is Pamblos, before they can do deliver.
Rosemary Dasi is also a resident here. Her water broke in the dead of the night last year. With no canoes operating in the night and no traditional birth attendants, she had to wait for 4 hours to get a canoe, enduring severe pains and putting her life and the baby on the edge.
It
started around 1 a.m. I felt funny, and my husband called his mother and grandmother. They confirmed my time was due. The canoe came around 5 a.m.
Rosemary delivered, but she does not want to relive the same experience.
I was in pain, and I couldn't sit in the canoe. After an hour, we got to the banks of the river, and I was told to quicken my steps. I got to the hospital and delivered safely, but it was a horrifying experience.
Pregnant women aren't the only victims here. Other sick persons face similar challenges too. They rely on first aid until they get access to canoes, which are not readily available. Rosemary now has 2 children. She tells me how she takes care of them anytime they are unwell before seeking medical attention.
I take my children through steam inhalation or give them some herbs anytime they are unwell until I get a canoe.
Health personnel visit the community occasionally to provide life-saving health services like immunizing their babies. Today is one of such days, and we tag along community health nurses at the Botiano Clinic as they embark on a journey to Faana. We finally reached a community trapped between the sea and the lagoon. Onansis Kankam is a visiting nurse.
If there is money, let's say every 2 weeks, we're able to come. But if there is not money, once in a month, then we try our best and then come. Yes, yesterday, a similar one just occurred. But by God's grace, we were able to see it.
What happened? Can you narrate what happened to me?
You see, there are certain area that when we get, the sea has just joined the lake. So it makes it difficult to pass through the waves. So we were stuck. But let me say, with the techniques of the captain, that is the one driving the boat, and by God's grace, we're able to say through. It's not easy. It's not easy. If you don't, if you are not a man, let me say that if you are not a man, you cannot come. You rather go back, or you feel reluctant to come to this particular area to work.
An asthmatic patient died here earlier this year. Sister of the deceased, Gifty Akoli, spoke to us.
He had complications and died in a canoe before he could reach a health facility.
Half a dozen newly born babies have died in the past 6 years because they could not get to a healthcare facility early enough. Son of the chief of the community, Bismarck JoyNews, tells us more.
Actually, bare to my knowledge and based on what I've come to, clinically about 6 people who have delivered on the way. Bare to my knowledge, that's what I've heard and what I've seen. But clinically, 6 people who have delivered on the way.
And how many have lost their babies?
Yeah, actually, that's 6 people that I'm talking about. 4 people lost their baby on the way. 4 people lost their baby, and 2 have lost their life. 2 people lost their life and 2 people lost their baby.
Until the government comes to the aid of the community in dire need of healthcare centers like that of Faana, many lives will continue to be at risk. Henry Kwesi Bedu for JoyNews.
Joining us via Zoom is Country Director for Send Ghana, George Bimpe, for more on this. Good afternoon, George. Please unmute your microphone. Now let's start with your reaction to this revelation about a community located in the capital and in this kind of situation after nearly 3 decades of uninterrupted democratic governance. What do you make of it?
Well, you know, the stark reality is that oftentimes when we talk about poverty, and this is a multidimensional poverty, not necessarily income level, we often tend to look outside Accra. But within Accra, the averages always hide the reality. And so oftentimes, such critical segment of our population are not getting the needed attention in terms of services that they need. And that is a big shame on us that we have not seen a true correlation between democracy and development that is driven on the principles of equity, and that certainly should have gone to this kind of, this unfortunate segment of our population. And that is a big indictment on all of us who think that we have come of age as a democratic state.
Now in Ghana, we spend $147 per person in the healthcare sector. Some would say that that is a huge investment. I remember sometime in 2005, the GDP percentage was 6.2%. Where are we going wrong? Is it the allocation of resources, for instance?
Well, it's both. You see, it's so easy to say that we spent X amount of money per head. But the thing is, are we really bothered to look at how much of that per capita expenditure actually goes into improving the well-being or the health status of the citizens for whom we are quick to strike averages. If you look at the expenditure carefully, the health expenditure carefully, you realize that capital expenditure has been on the lower side for some time now. In much the same way, goods and services have also been on a downward trend. Majority, the greater part of the budget goes into the major item, which is emolument. And if you look at it that way, it is only the health professionals who largely consume, especially GOG funding to the health sector. And so it may be too simplistic for us to strike the averages and use the per capita expenditure in the sector to say that we are doing well. We are not doing well in terms of our inability to meet the Abuja Declaration on Health Financing, which basically requires us to devote a minimum of 15% of budgetary resources. The furthest that we have gone, I think about 4 years ago, must have been around 9% thereabout. So we have not, over 15 years, after 15 years or so of signing the Abuja Declaration, we have not shown so much commitment in terms of prioritizing health expenditure and basically using equity consideration in the allocation of the resources. And if you look at it carefully, you realize that the poor who are in impoverished communities are shortchanged in terms of allocation of resources. They do not have the facilities. They do not even have the human resource. The nurses and the doctors oftentimes refuse postings to such communities. There are no complementary services that can even entice them to take up positions there. So holistically, we have not approached health financing from a comprehensive programming point of view.
Right. Now, you speak of comprehensive programming. This is not just a healthcare issue, is it? Because you see the clear cases of inequality where because you are in a rural community, you are mainly poor people, very little commercial activity. All the basic amenities they need are not there.
Yes, that's the point I was making about a lack of equity consideration in how we allocate budgetary resources. Certainly, you would take into into account the circumstances of the impoverished, so that when you are allocating resources, you make conscious effort to ensure that the imbalance between the rural communities and the urban communities are somehow addressed by pushing more resources. So, for example, you want to address their needs in terms of road infrastructure, so that even if you may not be able to provide them the health facility, there are motorable roads on which they will ply their abubo yars, whatever name we call it, to the nearest health facility. But here is the case that many even do not have electricity, they do not have education facilities, and you see, the higher your education level, the higher the propensity for you to even avoid a certain form of illnesses. And if you do not address social services in a comprehensive context, we may still continue to be having this problem so long as we continue to use a hard work and then haphazard, piecemeal approach to addressing the issue of healthcare or social service in rural areas.
Now, I want us to be able to capture this challenge and how wide it is. In 2012-2013, the World Bank has shown that about 50% of Ghanaians live in rural communities, but they account for 78% of the poor persons in Ghana. That means there's a higher chance of you being poor if you live in what is classified as a rural community. We know we are not paying enough attention to them, but where can we start?
Well, we need to understand the extent of the problem. The Ghana Statistical Service about 3 weeks ago released a report on multidimensional poverty indicators in Ghana. And basically it says that about 45% of our population are poor. If you look at it from a multidimensional perspective. What it simply means is that 45% of our people do not have access to water, access to electricity, access to healthcare, and so on and so forth. And if you look at it carefully, those in the rural areas currently account for about 43% of the population. And this deprivation is very endemic in rural communities. So let us understand the reality of it, and then request for a comprehensive, social protection programming to address the needs. And in doing that, we don't need to forget, we need to certainly consider issues of social infrastructure as also part of the social protection intervention that we provide. Oftentimes, we look at only the social services that we provide. But I think that because of the complementary nature that you need to build linkages in the program that we give to them, so that we address holistically the extent of poverty, inequality, and deprivation from a more comprehensive approach, that really requires a lot of political commitment rather than sloganeering that oftentimes clouds our judgment in terms of determination of what intervention we ought to implement to address or to support these vulnerable groups, so that we as a country can benefit. Because once we address their problem, they are put in a position to make greater contribution to the development of the country. And so it seems that we are condemning or we are denying ourselves contribution of about 45% of our people. And that doesn't augur well for the development journey that we are embarking on as a country.
And that number really stands out for me, 45%. That translates to about 13.5 million Ghanaians who are poor.
Multidimensionally, yeah.
Yes. Well, if you can shed some light on that term multidimensionally for any of my viewers who may not understand, what does that mean?
Well, oftentimes you hear that poverty level has reduced. So at the moment, if you take income poverty measure, we can talk about 23% of Ghanaians being poor. But that is only looking at the issue of income. Beyond income, there is the issue of access to social services. So in this community, they are poor in terms of a lack of access to health facilities or health care. That means that it is not only income poverty that they are suffering from, but poverty of health care. There are some communities that lack basic education facilities. So you may put it as poverty of education facilities. Even security, livelihood, nutrition, all those are factored in. There are some people who cannot get the 3 square meals a day. The nutritional content of the meal they eat doesn't meet the minimum requirement as per convention establishes. And so these are the different variables that you take into account to measuring the multidimensional aspect of poverty. And so then, cumulatively, 45% do not have all of these, in addition to those that I haven't even mentioned. That is what it simply means, that they are simply poor. In P, you say, that is how you may put it, because it's not only about income, clothing, that is shelter, even where they sleep. They do not have standard accommodation. All those people are classified as multidimensionally poor.
Thank you very much. That actually brings us a lot of clarity in this conversation that we are having, so that we can understand well what's meant by multidimensional poverty. We want to bring the conversation to an end. You were talking about how we must bring it to fore, especially since we are in the election year, and we must see to it that political parties are able to make it a part of their agenda. Unfortunately, we find that these persons are most vulnerable to vote buying, so that persons who are experiencing any kind of poverty will see the quick payout on election day and then just go and vote. So what can we in the middle do to ensure that this becomes a serious issue that is dealt with by politicians?
Well, I think that the so-called middle, those of us in the middle, we need to understand that if we fail to act, the liability on us will continue to increase and we will be stressed out. So it is incumbent on us to see it as our problem rather than their problem. That's the first thing. The second point I want to make is that as Send Ghana, we have worked with our partners to influence the political thinking of the thinking of the key political actors, i.e. the political parties, and we have gone throughout the country to take perspective of citizens in terms of their expectation of the political parties, and we have engaged them. We are keenly observing and watching the kind of proposals they will make in their manifestos, so that we will see how those address the challenges that are confronting us regarding inequality and poverty. And then it will be incumbent upon us, and this is why I invite the media to continue to continuously engage the communities to understand why and to know which of the political parties is making the right proposals. In terms of the monetary inducement, my brother, we can't do so much about it, but I would say if they take it, if the politicians take it, let them take it. At least it will alleviate them, but let us advise them that once you take it, know that whoever is bringing you that money is buying your destiny. So, teach them a lesson. Let us continue that education to teach the politicians a lesson that we cannot take the people for granted, only to resurface after 4 years to just buy them a pot of porridge just to disappear. So if they take the money there, I would say let them take it. After all, it is their own money that these politicians may have siphoned in whichever way that they have used. We can't do so much about it. But let us educate them for them to interrogate the politicians. Beyond the money you are giving me, what is your party going to do to address my circumstances so that I'll not forever be dependent on you?
Mr. Bimpe, thank you very much for joining us. He is the country director for Send Ghana.